Ladies and gentlemen, the Honorable Bob McDonald, Secretary of Veterans Affairs.
Thank you. Thank you. Thanks to Rob for the great introduction. Good morning, everybody, and thank you for being here. It's been almost exactly 1 year since I stood beside House Veteran Affairs Committee Chairman Jeff Miller at the White House, and President Obama signed into law the Clay Hunt Suicide Prevention for American Veterans Act, giving VA additional authority to expand suicide prevention efforts for veterans in partnership with the community. This act builds upon a long series of executive orders issued by the President to improve access to mental health services for veterans, service members, and their families. I also want to thank Chairman Miller and also Senators John McCain and Richard Blumenthal for their determination in getting this important legislation through Congress. We're pleased to have Chairman Miller here with us today and look forward to hearing a few words from him shortly. Thank you for joining us, Chairman Miller. I also want to thank Clay Hunt's mother and stepfather, Susan and Richard Selke, as well as Jean and Howard Summers, who also lost their son Daniel to suicide. Both of these couples turned their grief into action to give hope to the hopeless and to save others from knowing the pain that they have known. We're grateful to them for their courage and their perseverance and are honored to have them here today. There are two other people I'd like to thank for being here. Both are very important partners in serving veterans. Senator Elizabeth Dole, who's here to speak on behalf of the nation's hidden heroes, the 5.5 million full-time caregivers who care for disabled veterans unable to manage by themselves. Always good to see you, Senator. And Lee Woodruff on the Bob Woodruff Foundation. Since 2006, the Woodruffs have made it their mission to navigate the maze of 46,000 nonprofits serving veterans to find and fund the most promising, the most innovative programs helping veterans. We're so impressed by their work that last November we signed a formal memorandum of understanding with the Woodruff Foundation to build on our past partnership by working even closer together. Acting as moderator for this event wasn't mentioned in that memorandum, but Lee graciously agreed to do us the honor, and we're grateful for her doing so. Thank you, Lee. A couple of weeks ago, Dr. Shulkin and I testified before the Senate Veterans Affairs Committee on our effort to make VA the #1 customer service agency in the federal government. This is called MyVA. It's our transformation of the VA. In fact, as we're meeting here right now, yesterday and today, our MyVA External Advisory Committee is meeting close by, and I'll have to leave here after lunch or at lunchtime to go visit with them. But this strategic transformation of the VA, strategic transformation of the VA, called MyVA, has a very important strategy called creating and strengthening strategic partnerships. It's a little known fact that the VA we know today was founded on partnerships. In the aftermath of World War II, General Omar Bradley, as VA administrator, reached out to medical colleges and universities across the country to enlist them in the cause of caring for veterans returning from Europe and the Pacific. The partnerships that he formed at that time are still the basis of VA healthcare today. Without them, VA couldn't accomplish its mission of caring for veterans, their families, or their survivors. Our MyVA initiative will build on that model to involve many others in collaborative efforts to do what no other single agency or organization can do alone. As the President said in signing the Clay Hunt Act, and I quote, "This is not just a job for government. Every community, every American can reach out and do more with and for our veterans. This has to be a national mission." For our part, VA is continuing to expand and improve its Veterans Crisis Line, which has answered nearly 2 million calls since its launch in 2007. Nearly a quarter of those calls were answered in just the last fiscal year, 490,000. That gives you an idea of how much we've ramped up our efforts. Now, the same is true for referrals to local VA suicide prevention coordinators. 1/4 of the 320,000 referrals made so far by crisis line counselors were made in fiscal year 2015. Crisis line counselors have dispatched emergency responders to callers in crisis over 11,000 times last year and over 53,000 times since 2007. Since adding chat and text services, they've engaged nearly 300,000 veterans or concerned families through chat or through text. These aren't just numbers. In many cases, the numbers represent lives saved. Just a few weeks ago, a crisis line counselor answered a request for chat from a veteran whose wife died in the past year. This was the first Christmas in 27 years that she wouldn't be with him, and he was depressed and he needed somebody to talk to. It turned out that he had called the Veterans Crisis Line before, and that time he had already decided to end his life before his daughter woke up. But talking to a crisis line counselor named Cynthia changed his mind. Remembering that moment made him want to contact the crisis line again and to thank Cynthia for bringing him back from the dark side to the bright side, as he called it. This is God's work we're doing on behalf of the American people. We can be there for troubled veterans thanks to the support of the President and the Congress, who have provided the funding to allow us to expand our suicide prevention and mental health services. Since 2009, we've hired nearly 9,000 more mental health clinicians, boosting their ranks by 65%. We now have over 22,500 clinicians providing mental health services, psychiatrists, psychologists, social workers, mental health counselors, and family therapists. Access to mental health services has improved greatly. The average wait time for mental health appointments is now just 3 days, compared to 4 days for primary care and 5 days for specialty care. VA is also a leader in mental health research, including the kind of studies only very large integrated healthcare systems like VA can conduct. Last year, we began a landmark study on the use of lithium to treat patients at the risk of suicide. Lithium has been prescribed for decades to treat depression, but there's never been a large-scale study proving its effectiveness in preventing suicide. VA is uniquely positioned to conduct such a study. With nearly 30 VA facilities participating, the study will be one of the largest medication trials for suicide prevention ever. Other studies are looking at the effectiveness of other therapies and medications, as well as whether genetics contributes to depression and suicide. In recent years, suicide rates have risen steadily for the general population, but not for veterans in the VA system. For the veterans in our care, rates have remained stable, maybe even declined slightly, which tells us that treatment works. But less than half of the veterans in this country are in the VA healthcare system. And among those who are, it's still a challenge identifying those who are at risk of suicide. There are some obvious indicators of risk, like schizophrenia, bipolar disorder, clinical depression, and a history of mental illness. But then there are other indications like PTSD, substance abuse, chronic pain, and sleep disorders. Younger veterans are still more likely to attempt suicide than non-veterans of the same age. That may always be the case. Military service, especially combat service, is extremely trying and often traumatic, physically, mentally, and spiritually. But it's estimated that 70% of veterans committing suicide are over 50 years old. These are men and women struggling with the effects of age, declining health, increasing disability, financial worries, and maybe most of all, loneliness. Part of what we're up against is changing public opinion about suicide. Fewer Americans have been raised to believe that suicide is always wrong. More and more believe suicide makes sense when life brings you more pain than pleasure and there's no other end in sight. Part of our challenge is to convince veterans that that's a wrong way of thinking for many reasons, including the pain inflicted on the ones you love that are left behind. For both older and younger veterans, there's another category of people at risk who fall within our area of concern. Our mission statement still comes from President Lincoln's promise to care for him who shall mourn the battle, and for his widow and for his orphan. We've updated that, given the large number of female veterans and growing number of female veterans, to say, care for those who have borne the battle and their families and survivors. Their families include their caregivers, who often bear extraordinary burdens on behalf of invalid veterans. Last May, I attended a caregiver summit hosted by the Elizabeth Dole Foundation, where I heard a caregiver share her story of having to care for her husband while battling her own depression and her own despair. She had had thoughts of killing herself, but about that time she met a VA caregiver support coordinator and got involved in VA's caregiver support program. She said the program saved her life. I'm grateful to Senator Dole for being here today to tell us more about the needs of caregivers, a group of people with passion that we should never forget. I'm grateful as well to all of our speakers and to everyone in attendance. We depend so much on the work of others to accomplish our mission, on your research, on your expertise, on your insight, on your commitment to suicide prevention. At VA, we care for millions of veterans with sick or broken bodies. We help veterans live better lives. We sometimes even save lives. But those of you involved in suicide prevention do even more than that. You don't just save lives, you save souls. You pull spirits back from the brink of despair, saving them from the worst possible outcome, giving them a second chance at life, and sparing others years of grief. Your work could hardly be more urgent, more honorable, or more deserving of the nation's support and the nation's encouragement. No one knows that better than the President. He has demonstrated his support for your efforts time and time again, and he will in the video you're about to see. God bless your work, and God bless our veterans. Thank you. Please watch the President.
Hello, everybody. To all of you at the VA and your partners, thank you for coming together today to make sure we're meeting our sacred obligations to our veterans. That includes working together to end the tragedy of suicide among our troops and veterans. And to all of you gathered there today, members of Congress, veterans and your families, caregivers, leaders from academia and communities across America, thank you for the work you do every day to reach our veterans when they need us most. As you all know, our veterans are some of the most talented, skilled, and driven folks in America. They come home ready to roll up their sleeves and begin the next chapter of their lives. Every single one of them has something extraordinary to give our country. At the same time, many of our veterans continue to recover from injuries like post-traumatic stress. I'm proud of the progress we've made in recent years, increasing awareness, improving access to care, and expanding research into prevention and treatment. Working together, we've helped save lives. But so long as any veteran is hurting and needs help, our work is not done. That's why last year I signed the Clay Hunt SAVE Act into law to increase peer support, simplify the way veterans access care, and recruit talented psychiatry students to work at the VA after graduation. Now we need you to keep up the momentum. We need to streamline the ways that different agencies work together, invest in the scientific research to improve our understanding of injuries like PTS, and build support among community organizations because caring for our veterans is a national mission. Caring for our veterans is one of the most important obligations that I have as President and Commander-in-Chief. Michelle and Joe Biden have made it their mission too, as part of joining forces, working with so many of you. Our veterans have done their duty. Now we need to do ours. Let's make sure we're doing everything we can to serve them as well as they have served us.
It's now my privilege and distinct honor to introduce Congressman Jeff Miller of Florida, Chairman of the House Veterans Affairs Committee. In all of my time at VA, Chairman Miller has proven to be an extremely knowledgeable and involved partner in caring for veterans. When VA faced a serious financial shortfall last summer because of all of our efforts to increase access to health care for veterans and also cure veterans with the new miracle drug of hepatitis C, a very expensive drug, Chairman Miller came through with the help needed to get additional funding through Congress. We recently shared with Chairman Miller our My VA transformation strategy, including 12 breakthrough priorities we believe will create irreversible momentum of positive change for VA. 6 of these priorities require legislative action, but with Chairman Miller's help and partnership, I am convinced that we will get these 6 pieces of legislation done, and we will deliver the outcomes that we promised at that Senate hearing, all positive outcomes for veterans. So we're very pleased to have Chairman Miller here today, a terrific partner, and we look forward to working with him in the future on behalf of veterans. Ladies and gentlemen, please join me in welcoming Chairman Jeff Miller. Jeff?
Thank you very much, Mr. Secretary. We call each other Bob and Jeff, and I think that's the way that we would appreciate everybody referring to us, because we're all in this as a team together. Dr. Shulkin, it's a pleasure to work with you, sir. My good friend, Congressman Beto O'Rourke. We come from different political affiliations, but when it comes to working with the veterans of this country, political affiliations know no bounds, and I'm sure you would understand that as well. We have all said that the key to curbing the epidemic of veteran suicides is access to care, effective care for our returning heroes. And we have all said for years, our committee has focused on making sure that veterans are able to get the care that they need, where they want it, when they want it. And it's a message that's starting to gain traction around the country and certainly within the Department of Veterans Affairs. We took a big step about 18 months ago when we passed the Veterans Access, Choice, and Accountability Act, which provided veterans more choices regarding when and where they got their health care, and we put dollars behind those choices as well. And I would say that VA is making strides towards building upon this program with its Choice Consolidation Plan, which our Committee on Veterans Affairs is going to be examining in more detail, Mr. Secretary, later today. VA's Choice Consolidation Plan seeks to improve the way the department works with non-VA healthcare providers in order to improve and expand services to America's veterans. A vast and diverse group who face challenges that are simply too big for any single agency to handle all by themselves. Bob and the Undersecretary, Dr. Shulkin, understand this well, and looking at the roster of participants in today's session proves that. Meeting the needs of our veterans now and in the future is going to require robust partnerships among a wide array of entities. Government agencies, private health care providers, medical experts, charities, and veteran service organizations alike. And most importantly, veterans and their families. And speaking of families, I know that Howard and Jean Summers, the parents of Sergeant Daniel Summers, as well as Richard and Susan Selke, are here this morning and will be speaking to you a little bit later. Let us not forget why we're all here today, so that no veteran will share the same fate as Daniel Summers and Clay Hunt, and that no parents will be forced to deal with the crushing loss of a child the way Howard, Jean, Richard, and Susan have. Anytime a veteran who risked their life to defend us at home or abroad and dies by their own hand is a tragedy. And we we all know we must do more to address this serious problem. We're approaching, as the Secretary has already alluded, the one-year anniversary of the Clay Hunt Suicide Prevention Act becoming law. It provides comprehensive, new ideas aimed at improving the accessibility and effectiveness of mental health care that's available to the veterans of our nation. It's helping ensure VA's mental health and suicide prevention efforts receive the crucial, independent, third-party oversight while creating a greater accounting of available services and fostering an enhanced community approach to delivering veteran suicide prevention and mental health care treatment. It was an important step towards helping stop the epidemic of veteran suicide. But there's more work to be done, and that's exactly why we and you are here today. Mr. Secretary, I can't thank you enough for the leadership that you've provided to this department, an agency of 330,000 employees, that many of which go to work every day, wanting to do the right thing for the people that have worn the uniform of this great nation. Dr. Shulkin, thank you, sir, for hosting this call to action. We stand ready to work with you and all the other groups that are representing here today to help put an end to this national tragedy and better serve our veterans.
Ladies and gentlemen, Dr. David J. Shulkin.
Good morning, everyone, and thank you again for being here. You know, I know everyone is here because they want to make a difference, and everyone understands that we have to do more to prevent veteran suicide. And you may know, this is not your typical federal conference. You may have gotten a little clue of this when you didn't get the location of where we're going to have this meeting until just last week. When the year turned over, it was actually January 2nd, and you think about what you need to be doing this year, what you need to be focusing on. Clearly, preventing veteran suicide was at the very top of our list. And when I sat down with my staff and I said, you know, we need to do more. And we need to bring the best people together to figure out what we can do together. And we're going to do this in less than 30 days. That was January 2nd. Today's February 2nd. And I saw the blood drain out of my staff's face. I was too new to the federal government to understand what I was asking them. I didn't understand that you had to put out federal contracting bids to find hotels and do all that. But I'll tell you, they pulled it off. They really did a miracle, Herculean effort to get us here today. And I thank them. But, you know, look, the reason for that urgency is because this is urgent. We are in a crisis. And when you're in a crisis, it is important to act as if you're in a crisis. And time does matter. We have to do more. You know the numbers, the estimate of 22 veterans take their lives every day. Well, originally, when I had this discussion, I was told we need 6 months to plan a conference. That's what you do. You know, you have to invite people and do it the right way. Well, if we had delayed another 5 months, instead of 30 days, 6 months, at the 22 suicides a day, you can do the math, that would be 3,300 lives that could be lost in that period of time. So that brings me to what we're doing here today. What we're really doing is we're trying to recognize what works for VA and what works in preventing suicides. And we have a lot to learn from our experience in homelessness and ending veteran homelessness. We've reduced veterans' homelessness 60% in the last 4 years. And we recognize it can't be VA alone. It was really our partnerships, the Secretary's leadership here in reaching out to government and community partners to really end that. And this is the model that we need to use with veteran suicides as well. So we're going to hear today from members of Congress, obviously Congressman Miller and Congressman O'Rourke being here right now, but veterans and their families, caregivers, VSOs, experts from academia and from other federal organizations. And there are really two main objectives. One is to take away actionable steps, things that we can do tomorrow and really change to make a difference in reducing veteran suicides. And the second thing, the second objective, is to foster greater collaborations between the VA and all of these other groups in government and in the community so that we can engage veterans more in seeking care. You know, I had mentioned the 22 suicides a day, and I think many of you know that 17 of those 22 don't receive their care in the VA healthcare system. And they're out there really being isolated and not getting the care. And we know that those who do get care in the VA healthcare system actually do better. That's scientifically known, that if you get care in the system, we can reduce the mortality, we can reduce the rate of veteran suicide. So that's really one of the objectives that we're doing. Now, I attend enough conferences to know that what really matters isn't always what happens here in the lecture room. What matters often is what happens in the hallways while you're waiting in line for the bathroom, at lunchtime, in our innovation room across the hall. So I encourage all of you to reach out, meet somebody new, a lot of people new, exchange business cards, really form those collaborations that we know are going to make a difference, because everyone who's here is here, as I said, to make a difference. To that end, I think you'll see our hashtag, Prevent Vet Suicides. If you are capable of tweeting, we'd recommend that you take advantage of that and you share your ideas and thoughts. If not, there are index cards in the back of the room. If you have some thoughts you want to write down, hand to a staff member. We will share those at the end of the day as well. I just briefly wanted to share, very briefly, a few things that VA is doing that we believe is working in preventing veteran suicides and are innovative, just to give you a quick sense about that. Beyond the face-to-face counseling and treatment that we do, we've really focused on other technologies. As the Secretary mentioned, our Veterans Crisis Line reaching hundreds of thousands of veterans every year. Our telemental health services, 380,000 telemental health visits last year. We're developing web-based apps on our App Store for veterans and their families to help them with mental health conditions. We're collaborating with the DoD, CDC, and state governments to improve surveillance techniques in mental health. We're working on a research to risk stratify and develop algorithms to identify early veterans at risk for suicide. We're using evidence-based protocols so we can actually study what works and what doesn't. We're integrating mental health and primary care in a way that, frankly, no one else in the country is doing, and so we're leading in that, and I think there's a lot to learn. We have outreach and peer counseling, 300 vet centers, 80 mobile centers. And finally, we're using measurement-based care so we can actually do continuous quality improvement and learn how we can do things better. Now, as Secretary McDonald said, we're approaching the first anniversary of the Clay Hunt Act. And I would just like to welcome what the Secretary said to Susan and Richard Selke and to Jean and Howard Summers. Susan and Richard, Jean, and Howard, thank you for your courage. Thank you for being here today. Thank you for your willingness to share with us. And your power, it really inspires all of us, and we're looking forward to hearing your comments. Section 6 of the Clay Hunt Act really talks about increasing collaboration between VA and not-for-profits and other organizations. We have 150 of these types of relationships under development with many of you and many others around the country. We're working on a one-stop website for veteran suicide prevention. We're bringing in independent evaluations of our programs to see what we can do better. And we're working with student loan reduction tools to bring in new mental health professionals into the VA, particularly psychiatrists. Our message today is that suicide is preventable and that we can make a difference. So thank you so much for participating today. And I hope that you'll take what you hear today and share it with others so we can learn together. Now, it gives me great pleasure to introduce somebody who has a really important perspective when it comes to veterans and the psychological after effects of trauma. You know, I had a chance to read Lee Woodruff's letter to her husband, the 10-year anniversary recently of his trauma. And I will tell you, it was very, very touching. And I would recommend that everybody get a chance to read that, the personal story that she shares. As a co-author of the New York Times best-selling book In an Instant and a contributing reporter to CBS This Morning, Lee Woodruff gets to share the story and put a face on veterans and other people who have suffered traumatic injury after having been in places all over the world where people serve our country. As the Secretary said, she and her husband founded the Bob Woodruff Foundation, and they've raised $30 million to date and invest that in programs and organizations that help veterans throughout the country, really making a difference. Lee resides in Westchester, New York. She's a self-declared half-empty nester. She has 4 children. 2 of them have flown the coop, and 2 still at home. I saw her getting them off to school on her iPhone this morning. She's a dog lover, although I guess little dogs. She still likes to read a newspaper in her hands, me too. She doesn't like opera or black and white movies, either do I. But she loves to do things and everything outdoors. She, most importantly, is passionate about veterans, and when we asked her if she could be here, she immediately said, absolutely, I'm there for the veterans. And so, ladies and gentlemen, it gives me great pleasure to introduce our moderator this morning, Lee Woodruff.
Doctor, I feel like you just checked out my Match.com page. Perhaps we should talk after the event. We can go see a movie together. I'm so excited to be here and so honored to be here, but I wish that I weren't. I wish that we didn't have the reason to convene and to get together that we do. And I honor the parents today here because I know how difficult it is to talk about your own trauma. And Bob and I are both honored. I'm already tearing up, how about that? To travel around the country and speak openly about our own experiences. And it was really right here in Washington where he was flown from Landstuhl to Bethesda Naval, where I was witnessing all of the families and their trauma and all of the young men and women, mostly young men 10 years ago, who didn't have families around them like ours, and who had to face a lot of this journey alone. And that became the impetus for us to do something, because we could, because we had survived in a miraculous way, and because we were a civilian voice, a little bit 2 steps off what the military journey was, and we had that pulpit. And so I stand here as that civilian, as someone not within your organization, but it gives me the ability to say that let us bring everything to bear that we can to this cause from the side of the fence that is so grateful for the service of all of you who stand up and raise their hand to go into areas of conflict when their country asks. And that deserves our highest honor and our highest care for when you and your families come home. So for the other nonprofits and VSOs I can see in the audience today, aren't we proud to stand here today and help try to solve this? And thank you all for being here.